We have quite good models. We call them risk prediction models, through which a genetic counselor can put all the information in and actually calculate the risk that you have of developing either breast cancer or ovarian cancer or even pancreatic cancer, which is also related to the breast cancer gene. So I would say that if you have a relative in your family who's been diagnosed at a younger age, so especially if they've been diagnosed at less than 50 years of age, then that puts you at a slightly higher risk, and you must take any cancer. It could be colon cancer or breast cancer. Younger age cancers, you must have a discussion. So like my grandmother had ovarian cancer in late 80s. So that would not count as family history, because, if cancers are diagnosed as we get older, so that is different.
Yes.
Usually they do not have a genetic implication. But if you have a first degree, by mean a blood relative, your father, your mother, or your paternal aunt, or your grandmother. So if you have a family history of cancers, check at what age they were diagnosed. Because I think that is very, very important. Also, if you have any type of cancer, then there are certain cancers, let's say for breast cancer, triple negative breast cancer, even if it is in 60s or 70s, it may have a genetic basis. So we counsel patients and actually send most patients with triple negative breast cancer for breast cancer gene testing. And if they carry the gene, it has an implication, of course, for their children, and also has an implication on them for their treatment as well, because we have a drug that actually targets that gene and may help them in living longer. And the other most important thing for me, I feel, is to know that you carry the gene is important, because a lot of ladies come to me and say that, when they're getting married, that, I have the BRCA1 or BRCA2 gene, but I don't want my kids to have it. So we can do something called, pre-implantation genetic diagnosis, and it's available in India now as part of oncofertility. So it's important to know your family history, and also what you can do is for the next generation, mitigate that risk. And, so that, you don't pass it on, because that's a huge guilt factor that a mother has, that, she has passed it on to her child, whether it's a male child or a female child. So I think it's important to know and then get yourself tested, see a specialist. Very important that before you do the test, you have genetic counseling. And it could be done through telegenetics. Apollo has a fantastic program of telegenetics run by Dr. Ganapati. So I think, all of these things are, I feel, educate yourself and, do something yourself. Be proactive about all these things.